Hey everyone. So today we're going to take another look, a little bit of a different look at lumbo-pelvic posture and control. Many times when people are dealing with low back pain, sacroiliac joint pain in the back, one of the very prominent things that comes up over and over and over again is a loss of control in one side of the pelvis over the other. So there's a little bit of a shift, maybe a torsion. And so in this case, what we're assuming is that I have lost the ability to control that left hip with regard to internal rotation. There are a couple of different ways we're going to look at this, but overall, the kind of unifying theme here is that I've lost the ability to control this hip and control lumbo-pelvic posture through my adductors, or specifically my ischiocondylar adductor. So we're going to re-engage this muscle that has kind of become forgotten. It's kind of lonely. It's kind of hanging out there, not really able to do its job. And positionally, the pelvis is such, lumbo-pelvic posture is such that it's really kind of forgotten what to do. So we're going to sit down in a chair, take your 4 to 5 inch exercise ball, place it between the knees, and this is going to help us re-engage that muscle right here. And you can see, once again, we've diagnosed the left side, so I'm focusing on a left hip shift that goes backward toward the wall. And we have a couple of different positions here. So right now we're just producing repetitions, but as we advance, we would then get a little more internal rotation of that hip. And so even though this ankle is out to the side here, what we're looking at is the thigh. This thigh, with the ankle out to the side, this thigh is internally rotated at the hip. So we're going to pull that left hip back, going to reach the right knee forward, and as we do that, we're going to squeeze that ball. This squeeze of the ball, again, is going to re-engage that adductor a little more deeply. And so as this recovers, as we regain function here, as we regain strength here, you'll get better control of this side. We'll restore that left hip internal rotation, and the entire lumbo-pelvic complex begins to benefit. Pain begins to decrease. It becomes a little easier to move, and you just notice that you feel more stable and more balanced in your everyday activities. So once again, crucial to get the diagnosis right. If you perform this exercise in the wrong position on the wrong side, you will actually deepen your dysfunction, possibly even deepening your pain and your frustration. So glad that you joined me for this. Please leave comments or questions below. You can obviously reach out to me at any time with comments or questions. I'd love to hear from you. Thanks so much for watching, and I will see you again soon.